even when your brain tells you there isn't. John Green. Contraindications for breast conservation therapy. Breast conserving therapy refers to breast conserving surgery, example, lumpectomy, typically followed by moderate dose radiation therapy to eradicate any microscopic residual disease. It is an alternative to mastectomy for patients with early breast cancer. Breast conservation therapy, when combined with radiation, became the standard of care for localized intraductal breast cancers, ductal carcinoma in situ. Overall survival among women undergoing partial mastectomy with irradiation compared to radical mastectomy, breast conservation therapy became standard of care for patients with tumors under 4 centimeters. The surgeon may also remove some of the lymph nodes under your arm to find out if the cancer has spread there. Breast cancer often spreads to these lymph nodes. It can then spread to other parts of the body, sometimes known as sentinel node biopsy. Tell your provider if you are pregnant or think you may be pregnant. What you should know before having breast conserving surgery. How much of the breast is removed depends on the size and location of the tumor, your breast size, and other factors. Breast conserving surgery allows a woman to keep most of her breast, but makes it likely she will also need radiation. After breast conservation surgery, most women will have radiation therapy. Some women might also get other treatments such as hormone therapy or chemotherapy. Choosing BCS plus radiation over mastectomy does not affect a woman's chances of long-term survival. If you think you want breast reconstruction, talk to your doctor before your breast cancer surgery. Side effects of breast conservation therapy may include pain, a scar and or dimple where the tumor was removed, a firm or hard surgical scar, and sometimes lymphedema, a type of swelling in the arm. Side effects of breast conserving surgery. Side effects of breast conserving surgery can include pain or tenderness or a tugging sensation in the breast, temporary swelling of the breast, hard scar tissue, and or a nipple that forms in the surgical site, change in the shape of the breast. Nerve pain in the chest wall, armpit, and or arm that doesn't go away over time. This can also happen in mastectomy patients and is called post-mastectomy pain syndromes or PMPS. If axillary lymph nodes are also removed, other side effects such as lymphedema may occur. As with all operations, bleeding and infection at the surgery site are also possible. Who can have breast conserving surgery? Breast conserving surgery is a good option for many women with early stage cancers. The main advantage is that a woman keeps most of her breast. However, she will, in most cases, also need radiation therapy, given by a radiation oncologist, a doctor who specializes in radiation. Women who have their entire breast removed, mastectomy for early stage cancers, are less likely to need radiation, but they may be referred to a radiation oncologist for evaluation because its patient's cancer is unique. Breast conservation surgery might be a good option if you are very concerned about losing a breast, are willing to have radiation therapy, and are able to get to the appointments, have not already had their breast treated with radiation therapy or BCS, have only one area of cancer in the breast or multiple areas that are close enough to be removed together without changing the look of the breast too much. Breast conservation surgery might be a good option if have a tumor smaller than 5 centimeter or 2 inches, and that is also small relative to the size of the breast, are not pregnant, or if pregnant, will not need radiation therapy immediately to avoid risking harm to the fetus, do not have a genetic factor such as BRCA or ATM mutation, which might increase your chance of a second breast cancer, do not have certain serious connective tissue diseases such as scleroderma or lupus, which may make you especially sensitive to the side effects of radiation therapy. Breast conservation surgery might be a good option if you do not have inflammatory breast cancer, do not have positive margins, see was all the cancer was removed, see below for discussion. Identified advantages to breast conservation therapy include reduced operative time, diminished psychological burden when compared with mastectomy, improved cosmetic outcomes, and limited side effects. Breast conservation therapy should be a consideration when the surgeon feels that the tumor can undergo excision with clear margins with an acceptable cosmetic result. Adequate margins if there is no ink on the tumor seen for invasive carcinomas, and 2 mm margins are the recommendation for DCS. Lumpectomy is typically recommended for DCIS or TIS and T1, T2 tumors if there are no other contraindications to adjuvant radiation. Adjuvant therapy for cancers usually refer to surgery followed by chemo and radiotherapy to help decrease the risk of the cancers recurring. Neoadjuvant therapies are delivered before the main treatment to help reduce the size of the tumor or kill cancer cells that have spread. Patients with invasive breast cancer who undergo breast conservation therapy should receive whole breast radiation. The purpose of radiation therapy is to eradicate any microscopic foci of remaining tumor cells in the conserved breast tissue to prevent local recurrence and distant metastasis. Before I proceed, please subscribe to my channel and click the notification bell if you want to hear further updates on this topic. Was all the cancer removed? During the breast conservation surgery, the surgeon will try to remove all the cancer cells plus some surrounding normal tissue. After surgery is complete, a doctor called a pathologist will look closely at the tissues that was removed in the lab. If the pathologist finds no cancer cells at any of the edges of the removed tissue, it is said to have negative or clear margins. If microscopic cancer cells are found at the edges of the tissue, it is said to have close or positive margins. Having positive margins means that some cancer cells may still be in the breast after surgery, so the surgeon may need to go back and remove more tissue. This operation is called a re-excision. If cancer cells are still found at the edges of the removed tissue after the second surgery, a mastectomy may be needed. Breast reconstruction surgery after breast conserving surgery. Before your surgery, talk to your breast surgeon about how breast conserving surgery might change the look of your breast. The larger the portion of breast removed, the more likely it is that you will see a change in the shape of the breast afterward. If your breast look very different after surgery, it may be possible to have some type of reconstructive surgery or to have the size of the unaffected breast reduced to make the breast more symmetrical. It may even be possible to have this done during the initial surgery. It's very important to talk with your doctor and possibly a plastic surgeon before the cancer surgery to get an idea of how your breasts are likely to look afterward and to learn about your options. Arm care after lymph node removal. No needle sticks or IVs placed in the affected arm. No blood pressure measurement in the affected arm. Follow instructions about arm exercises carefully. Avoid injuries such as cuts or splinters to the affected arm. Raise the arm with your hand above your elbow to help drain lymphatic fluid. Wear gloves when gardening or doing any activity where there is a risk for getting a cut on your fingers or hands. Also wear gloves when using strong or harsh chemicals such as detergents or household cleaners. Avoid sunburns. Use a clean razor to shave under your arm. Avoid wearing any tight items to the affected arm. This includes elastic cuffs, tight watches, or other jewelry. Use your good arm or both arms to carry heavy packages, bags, and purses. Avoid insect bites or stings by using insect repellents or wearing long sleeves. Following curative treatment of non-metastasized breast cancer with breast conserving therapy, imaging surveillance is of utmost importance to monitor for local regional recurrence. Bilateral mammography 6 to 12 months after completing radiation therapy, followed by an annual screening mammogram and biannual breast exam is the recommended procedure. Breast conservation therapy complications, they are seroma, hematoma, fat necrosis, infection with the development of cellulitis or abscess, altered sensation to the breast and or nipple, close or positive margin, poor cosmetic outcome, lymphedema following sentinel lymph node biopsy, wound dehiscence, especially in oncoplastic technique, most commonly seen at the inverted T junction in a wide incision pattern. Relative contraindications, prior radiation therapy to chest wall or breast. Active connective tissue disease involves the skin or scleroderma. Extensive positive pathological margins. Relative contraindications, tumors greater than 5 cm, large tumor size relative to breast, known or suspected Li-Fraumeni syndrome or P53 mutation, women with a known or suspected genetic predisposition to breast cancer, BRCA1, BRCA2, absolute contraindication, first trimester pregnancy. Radiation therapy is contraindicated during pregnancy. However, pending other treatments needed. BCT is reasonable for some second and mainly third trimester patients who can receive radiation after delivery. Multicentric disease. Diffuse, suspicious, or malignant appearing microcalcification. are also absolute contraindications. Extensive ductal carcinoma in situ, inflammatory breast cancers, tumors with clear margins are unobtainable with lumpectomy with favorable cosmetic results, homozygous for ATM mutation. Research done by Dr. Ray J. Levakin. Give yourself another day, another chance. You'll find your courage eventually. Don't give up on yourself just yet. By Anon. If you want to hear more about these updates, please subscribe to my channel and click the notification bell. Thank you.